What do or can geriatricians do for older adults with cancer? I've been asked this question many times. I have taken care of many older adults with cancer for the past 12 years. I'm going to tell you what geriatrician and geriatric care providers can provide, why you need one if you're diagnosed with cancer, and what will you be missing if you don't have one. We all know that the number of older people with cancer is increasing. This is a big challenge to doctors and hospitals. Older patients often have other health issues, may have difficulty to live independently, and might have problems with thinking clearly, and they can be more easily harmed by treatments. To address this challenge, we suggest that all older cancer patients should go through a special evaluation called geriatric assessment. This assessment helps find problems that might be missed during your routine visit with other doctors. This assessment also suggests ways to help patients stay as functional as possible, which might even help them live longer. Unfortunately, these comprehensive assessments and coming up with effective solutions can be tough for cancer doctors. They may not have the training, time, or the resources that's needed. In this article that we have published about 10 years ago, we have explained how the geriatric service cares for patients with cancer from when they first diagnosed to the end of their lives. We emphasize how important geriatric assessment is at each stage of cancer treatment and how special tools are used to personalize the treatment. So let's discuss major points of this article. The most important thing is to focus on what the patient needs and wants. This is especially true for older cancer patients because a disease-centered approach might ignore other important factors. In this article, we also discuss the value of teamwork between cancer doctors and geriatric nurse practitioners and how parts of this team approach can be used in a busy cancer practices. As the population ages, the number of cancer cases is also expected to increase. The way that some tumors behave can change with age, and aging process itself can cause changes in the body that affects how well organs work. It's important to remember that patients' functional age, how well they function, can be different from their actual age. This needs to be considered when deciding on the best cancer treatment. Some older patients might be very healthy, while others might have some decline in their physical condition and some might be frail. It's crucial to identify patients who are in good shape because they are more likely to handle standard treatments well. Healthy older adults usually don't have many other health conditions. They are able to function independently and don't have issues like frequent falls or dementia. On the other hand, frail patients have multiple health problems, they struggle with their independence, they may have cognitive impairment, and they are more likely to experience negative effects from treatment. Because of these factors, frail patients might not benefit as much from cancer treatment. I'm sure you've heard about the term patient-centered care. This type of care is a major goal in our healthcare system. This means providing care that respects patients' preferences, needs, and values. The goal is to make sure that patients' values guide all of our treatment decisions. The patient-centered approach is especially important for older cancer patients who often see as many doctors and receive powerful treatments. For these patients, it's essential to assess their functional abilities, cognitive function, and other aspects of their health using a comprehensive geriatric assessment. In the case that I'm going to discuss, we are going to show you how patient-centered principles are used in the care of older adults with cancer. This is an 88-year-old woman with a history of high blood pressure, osteoarthritis, and reflux who came to the hospital with abdominal pain and anemia. Colonoscopy showed that the patient has had colon cancer. The standard treatment was to remove part of her colon, and she was referred to geriatric service for an evaluation before surgery. Older surgery patients have specific needs that go beyond their usual pre-surgery checkup. Older patients may have reduced physical reserve that aren't always obvious, and unfortunately at times common assessment tools are not good at predicting surgical risks. Geriatricians use geriatric assessment, which is a more in-depth evaluation that often uncovers issues that a regular exam might miss. Geriatric assessment is a valuable tool for predicting surgical outcomes, and guidelines recommend using it for older surgical patients. However, unfortunately, only a small percentage of surgeons routinely use this assessment. For this patient, in addition to the usual preoperative evaluation, she underwent geriatric assessment and was found to be in good shape. She had few other health conditions, she was independent, and she had good social support. So now, let's briefly talk about cancer surgery in older adults. Majority of patients with colorectal cancer are older than age 65, and 70% of them have early stage disease. For these patients, surgery could be curative. Age alone shouldn't be a reason to avoid a standard treatment. However, older patients may have other health conditions that increase the risk of complication after surgery. We need to carefully select patients for surgery because frail elderly patients are at higher risk for complications. This patient had an average risk of complication but a higher risk of needing to go to a nursing home or rehab facility after surgery. We discussed that risk with the patient and the family, and family was prepared to take care of her at home should she need some additional care. Following surgery, the patient recovered well and was discharged after 5 days. Geriatric service worked with the surgical team to prevent delirium, which is a state of confusion after surgery, and encourage physical therapy. We also educated the patient and her family on the importance of deep breathing exercises, and because she recovered quickly and had support at home, she was discharged without needing additional services. Let's briefly talk about challenges after cancer surgery. Older patients are at high risk for complications after surgery, such as delirium, poor nutrition, pressure ulcers, falls, and functional decline. Delirium is particularly concerning because it can increase length of stay in the hospital, costs, risk of further health problems, and even death. It can also lead to the need for long-term care facilities, which can significantly impact the patient's and family's quality of life. It's important to educate older patients and their families about the possibility of postoperative delirium. We also focus on managing pain, educating patients on breathing exercises, encouraging early movement, and taking steps to reduce the risk of delirium. About a year later, this patient developed metastatic disease and began chemotherapy in another institution. Unfortunately, she experienced complications and sought further treatment with us. In our institution, we discussed her life expectancy, treatment goals, and the risks and benefits of chemotherapy with her and her family. Because the patient wanted to pursue anti-cancer treatment, she was referred to geriatric service for help with managing symptoms and providing supportive care. Another geriatric assessment was performed, which showed that she is now more frail than before. We refer her to a nutritionist because she has lost significant amount of weight, and physical therapist because she had fallen multiple times. Geriatric assessment can help doctors make better treatment decisions. Based on the result, we can reduce the intensity of chemotherapy or provide additional support so the patient is able to tolerate treatment much better. Geriatric assessment can also help personalize treatment for older patients who may be at higher risk for toxicity. For this patient, a tool was used to predict the patient's risk of chemotherapy toxicity. Based on the result and in discussion with the patient and her family, she was started on reduced dose of chemotherapy. Geriatric service nurse practitioner closely monitor her to provide supportive care. In a collaborative geriatric oncology model, oncologists and geriatric nurse practitioners work together to care for older patients with multiple health conditions. This model includes the patient, their support system, the oncologist, and a geriatric nurse practitioner who communicates with the patient's primary care provider. They work together to create a patient-centered care plan. Given the limited number of geriatricians in the United States, geriatric nurse practitioners play a crucial role in providing geriatric care to cancer patients. Geriatric nurse practitioners are involved in education, prevention, supportive care, and symptom management, focusing on early assessment, timely interventions, follow-up, and care coordinations. Our patient tolerated the reduced chemotherapy well, and the geriatric nurse practitioner assessed various issues such as side effects, uncontrolled hypertension, constipation, weight loss, and vitamin D deficiency. We were able to maintain her quality of life for the most of the treatment, and she was able to see her first great-grandchild. As eventually her disease progressed, geriatric service was actively involved in goals of care conversation, answering all of her and her family's questions and providing emotional support for her and her family. She was enrolled in hospice and passed away in peace with her family surrounding her. In summary, as you see in this case, geriatric service is very much needed for the care of older adults with cancer. There are significant gaps in the care of older adults with cancer that only geriatric care providers are able to fill. It's also important to note that geriatric care is and should not be a one-stop shop. It should be across cancer continuum, providing dynamic support for ever-changing needs of older adults with cancer and their families.